is December 1st, 2021, and I am the chair, Jerry Paulette, state representative from the 46th district. And today we have a really packed agenda, and it includes preliminary reports on several very important legislative auditor reviews of starting with School Employees Benefits Board, Unemployment Insurance Training Benefits Program, the Healthcare Authority budget structure, which is a proposed final report, not just a preliminary report, and a final report for action on impact fee deferral programs. And then the annual major work of this committee is the review of tax preferences. We have in front of us the reviews of tax preferences from the legislative auditor's staff, and they will be presenting summaries of each of the major items. And we have the Citizens Commission as well on tax preferences, their recommendations on these. We will be hearing from Chair Grant Forsyth of the Citizens Commission for Performance Measure of Tax Preferences. We have one proposed comment on them. And because of how action-packed our agenda is today, I'm going to ask people to bear with me, and that we had planned for 35 minutes, I believe, on the school employee benefits and the unemployment insurance training benefits programs. We'll probably try to do that in 30 minutes each, so that we have time to, before we adjourn, to make sure that we have fully discussed the tax preferences. Any questions about our agenda? All right, our first item of agenda is the approval of the September 22nd meeting minutes. Is there a motion to approve those meeting minutes?
Move to approve.
Mr. Chair, so move.
I heard a motion from Vice Chair Orcutt and a second from Senator Short. Thank you very much. We will proceed with a voice vote. All in favor, please say aye or in favor. Aye.
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 Are there any opposed to adoption? Any opposed? Not hearing any opposed. Any abstentions? Not hearing any. Please record that the vote was unanimous for adopting the meeting minutes. And I suppose I should stop to ask staff how many committee members we now have, make sure that we actually had a quorum for that.
We have 11, but do you want to do a attendance roll call?
I should have done that before. Thank you very much.
I can do that.
Yeah, thank you.
Okay. This is a roll call for attendance at the December 1st, 2021 JLARC meeting. Representative Berg.
Present.
Representative Fye.
Present.
Representative Frame.
Present.
Representative Gaynor.
Here.
Senator Hasagawa. Representative Hoff. Senator Lovelet.
Here.
Senator Mullet.
Here.
Representative Orcutt.
Present.
Representative Paulette.
Here.
Senator Rivers. Senator Saldana.
Present.
Senator Short.
Here.
Representative Stokesbury.
Here.
Senator Wagoner.
Wagoner is present.
Senator Wilson.
I am here.
We currently actually have 13 in attendance.
Great. I want to thank everyone who is joining us today. I know that everyone is getting extremely busy at this time of year, and having 13 members present, is reflective of the importance of the reviews that we're looking at today. So thank you all for making time on your agenda as you're preparing for the regular session, and life is getting really busy. If anyone wants to move that life is not getting busy for session, we will entertain that after the meeting is over. So for right now, let's dive into the first presentation, which is the School Employees Benefit Board coverage. And this is a pretty complex subject, and a huge interest, I know, of everyone on the committee, and many, many people beyond the committee are watching and seeing what the results of this legislative audit are. So with that, Melanie and Stephanie, would you please introduce yourselves and kick us off?
All right, good morning, Mr. Chair, members of the committee. My name is Melanie Stidham, and I'm joined by my colleague, Stephanie Hoffman. We are here today to share the findings from our report on School Employees Benefits Board coverage. The legislative auditor has concluded that the percentage of employees eligible for healthcare coverage through SEB increased to 77%. On average, districts reported paying an estimated 31 to 44% more per month under SEB. Ongoing collection of similar eligibility and cost data will require changes to agency reporting requirements. The School Employees Benefits Board, or SEB, went into effect in January 1st, 2020, which was partway through the 2019-20 school year. This is a system that offers employee health benefits to school employees and is similar to PEB, which is the system that offers employee health benefits to state employees. Prior to SEB, all 295 school districts throughout the state negotiated their own benefit packages with carriers. Eligibility and costs varied by district and by position type. Under SEB, there are several key differences. One is that the board negotiates benefit packages with carriers on behalf of all school districts. The legislature has set eligibility criteria at 630 hours per school year for all school employees. And districts pay the same rate for all eligible employees. This rate is comprehensive and includes medical and other benefits, as well as all fees. Employee rates are also the same when the employee makes the same plan selection, regardless of what district they work at or their position type. In 2020, the legislature asked JLARC to collect data on school employees and health coverage, eligibility for health benefits over the 2018-19 and the 2019-20 school years. Specifically, we were asked to report on the number of employees by position type and ranges of hours worked, how many of those employees were eligible for medical benefits, how many of them waived their coverage, the amount that the districts paid for those employees' health benefits, and the number of certificated and classified benefit units funded in the operating budget. Now, this last box does warrant some definitions. Certificated positions require the employee to have a certificate, such as a teaching certificate, and classified positions do not. A benefit unit is a budgeting term, and Stephanie will go into a lot more detail with that later in this presentation. We reached out to all 295 districts and ultimately were able to use data from the 212 districts that you see shaded in blue on this map. Districts within the study reflect the variation in district size and geographic distribution across all 295 districts. During this presentation, we're going to be throwing out a lot of numbers, and this is actually just a fraction of the overall numbers we collected over the course of the study. All data that we collected is available through interactive dashboards that you can access through Appendix A in our report. The dashboards allow you to view the data in a more detailed way with a breakdown of position types and hours worked, and also allow you to filter the information by individual school districts. Going back to the study mandate slide, this is going to serve as the outline for the rest of the presentation, starting with the number of employees. Within the 212 districts in the study, there was a 1% net reduction in employees between the 2 school years. The bars on this graph are divided into 3 sections. On the left is the number of employees that work part-time less than 630 hours. In the middle is the number that worked part-time 630 hours or more. And then on the right are the full-time employees. The lighter color on top of each bar represents the classified employees, and the darker color are the certificated employees. Just over half of all employees work full-time. When we bring in numbers from 2019-20, we can see that the trends are largely the same, although there are slightly fewer part-time employees and slightly more full-time. Looking at numbers by position type, most positions did not see a noticeable change, with the exception of substitute employees. Overall, there were 12% fewer substitutes in the 2019 school year. This decrease appears to be due to school closures related to the COVID-19 pandemic. One thing of note is that the vast majority of substitutes in both school years work less than 630 hours. A more granular look at the data, which is available through those appendices I mentioned earlier, shows that most of these employees actually worked less than 539 hours. Far fewer substitutes worked part-time 630 hours or more, and just over 100 worked full-time in the 2019 school year. Now we're going to look at how eligibility for health benefits changed under SEB. Of all the employees in the 212 districts, 68% were eligible for benefits in the 2018 school year, and this increased to 77% eligible under SEB. Taking a narrower focus, we'll look at how those changes vary between full-time and part-time employees. First, looking at the full-time employees, the eligibility didn't change much between 2018, which is the blue bar, and SEB, which is the yellow bar. In the gray boxes to the right, you can see that in 2018, 94% of these employees were eligible for benefits, and under SEB, 100% were eligible. For part-time employees working 630 hours or more, there was a shift from 70% to 97% eligible under SEB. And when looking at part-time under 630 hours, there was a slight decrease in eligibility, but we were actually a little surprised to see anyone eligible under SEB, since that threshold is set at 630 hours. In the report, we list several reasons, one of which is that the employee may have started a benefits eligible position partway through the school year and didn't have time to reach 630 hours.
Representative Paulette, I think Senator Mullet has a question.
Oh, well, thank you very much. And I encourage you to please highlight when people put up their hand for me. Senator Mullet, please. You're muted, Senator Mullet.
Thank you, Chair Paulette. So Melanie, I think one of the questions the legislature had in the subspace was, in the old system, some teachers might be a sub in the same district the entire year and go over the threshold. And under the new system, I think the fear was that it would just force more moving around, because they could get over 630 hours, just not in the same district. So districts would have a sub, and then when they got close to that threshold, then there'd be a lot of moving around. It seems to me like because of COVID, it's really hard on this data to know. I saw your slide a few slides ago that showed there were fewer subs who got over 630 hours, but it's also, I mean, in your estimation, do we just have to wait and look at this data again when the COVID impacts aren't smack in the middle of the study, I guess?
Well, for sure, COVID did have a pretty big impact in that particular employee group. But one thing to note is that many of the substitutes, well, really the vast majority, were under 539 hours, which isn't really that close. That's the furthest hour bracket from the data that we collected from that threshold. And so a lot of people weren't really that close to the threshold. We do know that with substitutes, with any employee really, if you worked in multiple districts, and you worked 630 hours, but your hours were spread across districts, there isn't really a mechanism to combine those hours across districts. And so it would be whichever district you meet a threshold in. Does that answer your question?
It does. Okay, thank you.
Okay.
Rep. Orcutt, did you still have a question?
No, not after I heard the rest of the response.
Let's do this. Unless you have a clarifying question on a slide, let's hold the substantive questions to the end, and we'll also have agency representatives available from HCA if there are questions. Okay.
Okay, so now we'll look at a little bit of change in eligibility by position. This is something we did look at. There were 2 positions that had a greater than 10% eligibility under change in eligibility under SEB. Transportation increased to 95% eligible, and paraprofessionals increased to 91% eligible. We were asked to report on the number of employees that waived their medical coverage between the 2 time periods. And this percentage dropped from 18% of eligible employees waiving their medical coverage in 2018 to 12% under SEB. As you can see on the graph, the greatest change was in part-time employees working 630 hours or more, which is the middle set of bars. With that, I will turn it over to Stephanie.
Thanks, Melanie. Now we're going to talk about how much districts paid for benefits under SEB compared to the 18-19 school year. And on average, the 212 districts reported paying an estimated 31 to 44% more per month for SEB benefits than they paid prior to SEB. We identified 3 factors that led to the increase in costs. And the first is a higher monthly employer rate that each district pays per eligible employee. Under SEB, this is a comprehensive rate that includes all benefits and administrative fees. Second is expanded eligibility. And third is that the districts pay the full employer rate for part-time employees rather than a prorated amount. Districts reported that their largest percentage increase in monthly costs was for part-time employees. And districts saw an increase in costs for both part-time staff working under 630 hours and those working 630 hours or more. And while the percentage increase was greater for part-time employees, the greatest dollar increase was for full-time staff because that group makes up the largest portion of district costs. We were also asked to look at how much state funding districts received for certificated and classified staff under SEB and how that compared to the prior year. State funding for employee benefits is based on 3 main components. The first is the total number of certificated and classified full-time equivalent staff funded in the budget. And this value is generated from several different K-12 funding formulas. Next is a benefit allocation factor, and this is a term unique to health benefits funding. It is a multiplier that is used to provide additional funding for staff. And this is intended to account for the fact that some full-time positions are filled by more than one individual, and each person may be eligible for benefits. These first 2 factors together equate to what is called a benefit unit for budget purposes. The third component is the health benefit rate, which is a monthly amount set by the legislature to provide funding for employee benefits. And combined, these 3 factors generate the total amount of state funding provided to districts for employee benefits. State funding increased under SEB. The legislature increased the benefit allocation factors which resulted in funding for 2% more certificated benefit units and 25% more classified benefit units. The legislature also increased the monthly benefit rate from $844 per month to an average of $1,010 under SEB. When we look at average monthly funding totals across the 212 districts, we found that the amount increased an average of 29% to $74.1 million per month. And this funding comes from 7 basic education programs. The largest share, 73%, is from general apportionment. Another 12% comes from special education. And the remaining 15% comes from 6 other programs, including career and technical education and pupil transportation. The final topic we're going to cover today relates to the data collection efforts by the Office of Superintendent of Public Instruction and the Healthcare Authority. And as a reminder, our study mandate specifically asked us to make a recommendation related to ongoing data collection. State agencies are not currently collecting all the data that would be required to answer the questions we addressed in our study. However, they do collect data relevant to many of our questions. OSPI currently receives a snapshot of employee level data from each district once per year. And this data includes the full-time equivalency of each employee, whether they are certificated or classified, and their position type. This data does not include the number of hours worked or all position types. For example, OSPI does not collect information on short-term substitutes. HCA collects information on eligible employees and the number waiving coverage in each district. But this data does not include the number of hours worked or their position types. So in light of this, the legislative auditor recommends that OSPI and HCA work with House and Senate fiscal staff to determine what additional data elements might be needed for ongoing data collection. If new elements are suggested, OSPI and HCA should each develop a data collection plan and identify resource requirements as applicable. And this recognizes that there is a cost to districts and to state agencies for collecting and reporting additional data, and understanding those costs will help inform a decision about whether to require additional data going forward. We'll be coming back to you in January to present our proposed final report. Here is our contact information. We're happy to answer questions, and we also have representatives from HCA with us today.
Right. We have some questions. The first ones I see are from Senator Saldana and Senator Wagoner. So Senator Saldana.
Thank you, Chair Paulette. So I have 2 questions. One is just clarification about the increased revenues the state has provided and versus the increased costs to districts. And just overall making sure that I have clarity, and or if there's ways for us to package it for folks to better understand that that basically, you know, what's their actual gap? Are they actually overall having to pay more per individual covered, or you know, are we actually adding more money to help kind of discount the fact that we have a value of wanting to have more people opting in, right? So that's my first question. And then the second one is just when I was looking at the at the level of percentage that our contribution pays for the overall cost of healthcare, with some, you know, there's a few that we actually pay more than what it costs. But there's one that is at the 25 to 49%. And so I was just curious about that outlier, and if you can provide a little bit more clarity around that.
Sure, I will attempt to, and Melanie, feel free to jump in as well. Overall, we found that the increase in costs ranged from about 31 to 44% among the 212 districts, and the increase in funding for those districts districts was about 29%. So within range, but as you saw, exhibit 5.4 is where you can see kind of where the districts spread out. So some are getting more and some are getting less. And the funding mechanism is not intended to be a one-to-one relationship. Districts have local control. The funding generates an estimate for number of employees, but the districts can decide to hire less or more than that. And they control how many hours the employees work. There's also a piece that's not included in state funding, which is costs for benefits may include federally funded positions or locally funded positions, which would not be captured in state funding. So that kind of gives you some sense of why there's variation. And we found that overall, the majority of the districts who were reporting their costs fell within sort of the 75 to 99% range of costs being covered by funding. The outlier, we do know the district potentially it is not as extreme as it looks, but one of the issues is that when you look at smaller districts, even a change of 2 or 3 employees can be a really significant percentage increase, or one way or the other, either an increase or a decrease. So some of the percentages can be misleading because of the size of the district.
Relevant to that, would you be able to, are you able to bring up or show the link to the Tableau so that members can see how they can actually look for their own district, because there's such a variation in whether or not your district, your school district and your legislative district are coming out whole or are behind or ahead. So, and while we're doing that, let's ask, let Senator Wagner ask his question.
Thank you, Mr. Chair. It looked from the map like we didn't get data on about 80 districts. Is there an explanation, and is that data coming or not?
Yeah, so we did get quite a bit of data from a lot of districts, but due to just the retroactive data collection and the way the different accounting and payroll systems interact, then we just couldn't use some of the data from those 80 districts. We actually only didn't hear at all from just a handful of districts. So we did get a really incredible response rate. We just can't quite use all the data. And the data we have is what we have. We don't really have a good way to get the rest of the data. We did reach out to districts and really work with a lot of them to try to get the numbers to line up. And it's not that they don't have the data, it's just the way that the request and the timing of the request from being several years out. It was just an enormous effort to try to get those numbers to line up.
Representative Paulette, unless someone on our administrative staff team can pull up the dashboards, I don't want to blow up Zoom by trying on my own. But I do want to mention that Appendix A of our report, if you click on our website, our report is one of the first to show up. And if you look at Appendix A, there's multiple dashboards. You want to choose the district level raw data dashboard, which is listed right on the Appendix A sheet. And once you go in there, you can identify which district you want. You can look at multiple districts and you can look at all districts together. If you have any issues with it while you're playing around, please just feel free to give us a call and we can walk you through it.
Perfect. Thank you very much. I think
Sure.
that's needed.
Someone was able to.
So this is a great tool for you to, every member, to look at a school district. I think we're.
Are you able to see it on the screen?
Yeah.
Okay.
Are there any questions for the Healthcare Authority staff from anyone, or other questions? Representative Berg?
Thank you, Mr. Chair. So I just had a question. So if we don't see a district, just to clarify, if we don't see a district on the dashboard, that means they did not respond? Is that?
Not necessarily that they didn't respond. There were a handful of districts that responded as best they could, and it just, the data was not consistent enough for us to include in our report. So the districts that you do see listed are the ones that we felt comfortable with complete data to include in our dashboards.
Okay, and then a follow-up question, if I can, Mr. Chair.
Please.
I just wanted to clarify just in terms of the recommendations, because I know there wasn't a recommendation for funding to cover those gaps. And that's because of some of the differences of positions and because there's local control and then you also have local and federally funded positions. Is that okay? And so that basically puts it outside of the scope because there can't be parity in terms of a one-to-one funding model. Okay. Thank you for that.
Sure.
I do think one policy question that is going to be arising, and many of you are probably hearing this from your educators already, is that there is incredible crisis in substitutes right now. We had a shortage before COVID, and now it is at crisis proportions. Is there anything in the report that addresses whether or not the 630-hour cutoff for eligibility may be discouraging people from helping to meet the shortage of substitutes?
Is that a question for us or for your colleagues?
Well, for our JLARC staff, it's not just. It's both the hours and I should say, and the inability to combine hours across two districts, I should really say. And is there anything in here that gives any indication or guidance to us on this policy question?
I could probably help here as well, Representative, but please go ahead, Melanie, first.
We asked districts about that, if there was a policy limiting number of hours to below 630. And the vast majority of districts do not have that, have a policy in place, but some do. And some districts in their comment, and that those can be seen through that dashboard. If you go to the district level data, there's a bar that says additional questions, and then it's that's where that would show on whether the district responded yes or no. And in their final comments, we always offer at the end of our request for information, and is there anything else that you wanted to share with the legislature about this topic? And quite a few did want to share on this, and just said that, you know, this was a bit of an unusual year with the substitutes, and that they would have had more people eligible if it had been a regular school year. A lot of those did not indicate that that was prohibited, that they were trying to limit hours on that. It was just that it was a strange year.
And perhaps one thing I could add, though, as an observation, Representative Paulette, is although I don't think we have sufficient evidence to say whether an hour limitation was discouraging people from entering or maintaining their employment in the profession. But the one thing that may be useful is, because we did collect information on multiple hour categories, there is some information about the current employees who are working at lower thresholds in the detailed data and in data that we shared with the fiscal committee staff from the report. So if there are interests in lowering the eligibility point to a lower hour threshold, at least there's some information that will help the legislature determine what the price would be to consider some potential other scenarios.
Thank you. Senator Wilson.
Thank you,
and then we have a response from Kate Walker from the HCA.
I need to clarify. I'm trying to follow along with some of this. The 12% substitute teachers reduction is, we're just lacking the teachers, or is it 12% that aren't covered by SEB?
So yeah, I apologize for there just being such a dramatic number of numbers in this report, and it's all rather confusing. So that 12% difference in that's the number of substitutes between the two school years. So when we compare the number in 2018-19 to 2019-20, there were 12% overall fewer substitutes.
Okay.
Most of those substitutes weren't eligible anyway because they were below the threshold. So that part doesn't really have much to do with eligibility.
Okay, thank you.
Mr. Walker, would you introduce yourself and offer the comments you wanted?
Thank you, Chair Paulette and members of the committee. My name is Cade Walker. I'm here on behalf of the Healthcare Authority. I had the opportunity to work with JLARC staff on this report and have been involved in SEB matters for quite a few years now. I'm also joined by Sean O'Neill and Megan Atkinson from the agency, but with regards to this report, I'm the primary point of contact. I wanted to respond, at least to provide a little bit more context about the eligibility for SEB benefits, that districts do have some greater level of flexibility in determining eligibility for staff, specifically for those who are part-time. The 630-hour rule kind of has a couple of components to it for districts to consider at the start of each year when they are making that determination of eligibility for their employees. And that is either they anticipate those employees to work 630 hours during that year, at which time they are deemed eligible at the start of the year and get benefits, or if they aren't anticipated to work 630 hours, but the past history has shown that that employee has worked 630 hours in that position for the prior 2 years, then they're also afforded eligibility from what we refer to as the 2-year look-back rule. So there's a couple of avenues that districts have with the current eligibility framework as it pertains to that 630-hour rule. Furthermore, there is a by statute 4105 740, I want to say it's sub 6E. 6D is where regular eligibility is that was set by the legislature with the implementation of SEB. But 6E eligibility affords districts the opportunity to locally negotiate eligibility that goes below the threshold of 630 hours. So any employee groups that they wish to negotiate with, they do have the statutory authority to negotiate locally and provide benefits to employees who are in a group that aren't normally going to necessarily reach 630 hours, or maybe there's a large population of them like substitute teachers that may not normally hit 630 hours or would not be anticipated to work 630 hours, but they could negotiate that down to say 500 hours. If they anticipate the substitutes working 500 hours, they could be deemed eligible and then would be part of the SEB benefits as well. So districts do have some flexibility. And as I've had an opportunity to speak with districts that have had questions related to benefits for their substitutes and part-time employees, I've shared that information with them, and it's part of their training as well with the SEB program of those options that they have for the initial determination of benefits under 6D eligibility and the option they have for locally negotiating a benefit threshold of a lower hour rate should they so choose. So I just wanted to provide those additional points of context with regards to eligibility.
Thank you. Any final questions? That was very helpful. Appreciate that. All right. We are going to end this discussion, and Auditor Konopasky, our path forward on this is we will hear a final report. Would you tell us the path forward?
Yeah, we'll have a proposed final report at our January meeting, and it's eluding me now the exact date because we did have to shift for scheduling purposes. Give me one
January 4th.
January 4th. And of course, as per our normal process too, we'll be asking for formal responses from the Healthcare Authority and OSPI and OFM if they have any for your consideration and we will be providing those in advance of the meeting. If the committee members want to propose any of their own committee comments to adopt, those will be coming out shortly in about a week from now.
Okay. Thank you very much. With that, let's proceed to the next item on our agenda, which is the Unemployment Insurance Training Benefits Program. And I will say, as we discussed at the executive committee meeting this morning, the findings here are quite myth-busting. Let's switch gears to unemployment insurance. And I do want to start with the caveat. This is a review that was started long before the concerns that this committee has about unemployment insurance benefits being paid through the pandemic. This is on training benefits and a pre-existing program. So with that, Ryan and Josh, would you please introduce yourselves and walk us through?
Great, yeah, thank you. And good morning, Mr. Chair and members of the committee. My name is Ryan McCord and I'm a JLARC analyst. And I'm joined by Joshua Karras. And as the chair said, we're here to present the preliminary report of our evaluation of the Unemployment Insurance Training Benefits Program. And the legislative auditor's conclusion here was that ESD's administration of the program complies with statute. However, it caused most participants to earn less than their peers over time. So as a reminder, statute requires JLARC staff to evaluate this program every 5 years. This is our second review of the program. We published our first one in 2016. So our presentation today has 3 parts. I'm going to give an overview and then talk about ESD's administration of the program. And then Josh will talk about the results of a net impact analysis of program participants' earnings. So beginning with an overview, the program is available to certain eligible people who are receiving unemployment insurance. The program provides 26 additional weeks of UI payments after participants exhaust their regular UI benefits. Participants must enroll in an approved training program and make satisfactory academic progress. And unlike regular UI claimants, program participants do not have to search for work while they're enrolled. ESD approves an average of about 1,500 applications per year, and it pays out about $10.5 million in benefits every year. Administration costs are a little less than $1 million per year, and most of that money is for salaries for the staff adjudicators who process applications and determine eligibility. The law that created the program lays out 3 objectives. The first is to make retraining available for unemployed individuals whose skills are no longer in demand. The second is targeting training to high demand occupations. And the third is to enhance the earning power and marketable skills of participants. So in the next section, I'll talk about how the program's implementation and administration achieves the first 2 objectives. And then Josh will discuss our finding that the program does not enhance the earning power of participants. So about program administration, ESD ensures that applicants meet eligibility requirements and that they select programs that will lead to occupations in high demand. The applicants submit that information, and then ESD staff adjudicators verify it through independent research. The department ensures that participants make satisfactory progress in their programs by requiring that participants submit periodic progress forms signed by training program administrators. The program has 3 primary partners, and those are ESD's own Employment Connections Division staff, the statewide WorkSource system, and the state community and technical colleges. Those partners serve a number of roles, including helping applicants complete the application form and offering resources to help applicants identify careers and training opportunities that are eligible for training benefits. One thing that the partners do not do is tell applicants about the risk that they may not make up for wages they might otherwise earn if they didn't take training. ESD told us that the onus is really on applicants to assess that risk. So our 2016 report, our last report, contained recommendations to improve implementation, and those included improving guidance to program partners, establishing quality review of the adjudication decisions, improving timeliness of those decisions, and clarifying the application form. So this time around, we asked ESD about the status of those recommendations, and they told us that the department reinstituted funding for positions at community college that serve training benefits participants. They provided training for workforce staff and held regular information meetings with Employment Connections Division staff. They created a tool and a process for management to use to ensure consistent decisions about applications. And they made efforts to improve the timeliness of decisions. One of those included implementing a new IT system, but the adjudication times, the time it took to process and decide applications, continued to fluctuate quite a bit above the 21-day federal guideline. ESD revised the application form, but did not actually change the questions that participants told us in 2016 that they found confusing. So Josh now is going to discuss the program's impact on participants' earnings.
Good morning. As Ryan mentioned, I'm Joshua Karras, and I will be presenting the impacts of the program. ESD conducted a net impact analysis designed to evaluate the program's effect on participants' earnings. ESD's economists began consulting with us about study methodology in 2018. The net impact analysis considered all participants who enrolled in the training benefits program from 2002 to 2016. All participants were grouped according to the year they enrolled into the program. We refer to these as cohorts. ESD also matched program participants to similar non-participating peers. And they used econometric regression models to estimate the causal effect of the training benefits program on earnings and employment. We contracted with economists from the Upjohn Institute for Employment Research. They independently reviewed ESD's net impact analysis, and they determined they had a high level of confidence in ESD's methods and results, and that it was credible. ESD's net impact analysis found that the first two cohorts earned more than their peers. All values presented here for participants are relative to their non-participating peers. This is the baseline for comparison. And we have summarized the results from ESD's analysis into a cumulative increase or decrease in earnings for participants. During the first 2 to 3 years, participants are enrolled in training. During this time period, they forego roughly $40,000 in earnings. After the training periods, participants from these two cohorts earn more than their peers. As they earn more, they eventually recoup their lost earnings from training and catch up to their peers in years 9 and 10. From then on, they continue to earn more than their peers. These first two cohorts were atypical compared to the others, and the program at the time gave aerospace workers preferential access. The following data from our previous report is what we're using for these slides. A higher proportion of cohorts were previously employed in the aerospace industry, 45% in the first two compared to 2% in the rest. And a higher proportion of these cohorts returned to their previous employer after they completed training, 41% in the first two compared to 13% for the rest. The first two cohorts were roughly 20 years ago, and the results for the later cohorts are different. ESD's net impact analysis found that overall, the later cohorts earn less than their peers. For the later cohorts, they also forgo roughly $40,000 in earning during the initial training period. The 2004 and 2005 cohorts experienced some positive earnings, but they've yet to catch back up to their peers. For the later cohorts, the participants again forgo earnings while they train. However, after the training period, most of these cohorts do not earn more relative to their peers, meaning the cumulative difference in earnings either stays negative or grows more negative. While some cohorts are doing better than others, all of them since 2003 have earned less relative to their non-participating peers. In our previous study, we requested ESD explore why some participants earned more than the others. In this net impact analysis, ESD found that younger and lower income participants did better. Of the participants that were younger than 36, 54% earned more than their peers. For the participants who were over 46, that decreased to 10%. The participants who were younger than 36 earned an average of $240 more than their peers, compared to the $16,500 less per year for the peers that were older than 46. And the average age of participants in ESD's net impact analysis was 41. ESD's analysis also concluded that participants with lower wages prior to enrolling into the program were more likely to experience better outcomes, and more information on this can be found in ESD's net impact analysis. ESD also explored which programs of study were associated with better results, but they found that the 20 most popular programs all yielded negative average earnings outcomes. The 3 programs that had the least negative results were healthcare, education, and protective services. Overall, the net impact analysis found that in general, the program does not enhance participants' earning powers. ESD concluded that the program caused participants to earn an average of $3,621 less per year than their peers. JLARC and ESD staff independently reviewed literature about similar training benefits programs. Both reviews indicated that participants generally do not make up lost earnings after trainings, even for the other programs. The legislative auditor's recommendation is because the training benefits program is not meeting the legislature's stated objective to enhance participants' earning power, the legislature should consider eliminating or modifying the program. We will be coming back to you in January with our proposed final report. You can find the report on our website, and the appendix also contains a link to ESD's full net impact analysis. And here's our contact information. We're happy to answer any questions, and ESD is also in attendance if you have any questions for them.
We have some questions. Senator Short.
Thank you, Mr. Chair. Really, when you talked about the issue of younger, lower income individuals having better outcomes than older individuals, is that probably because the salaries they had going into needing this training were probably higher to begin with?
That is a possibility. ESD is in attendance if they would like to discuss more of the methodology and sort of results of their net impact analysis.
And also, I'll add that one thing that contributes is that younger participants have more years of earnings. So before they retire, so they have sort of more years to catch up to their peers and make up for those initial foregone earnings during training.
Thank you, Mr. Chair.
Mute button go, and Senator Saldana.
Thank you. I have a couple of questions, and I think in the data you provided, I mean, you might not be able to get any closer, but it was very interesting to see the breakdown by ages and by cohorts. I wondered if ESD had information, or you had it, in terms of how many of the participants were coming from unionized workforces, and then, you know, through the training, where they ended up, was that also union work, where they had the opportunity to be part of a union, or was it non-union, and you know how that may or may not affect earning power. The other question I have is just around educational level of participants, if we have any data on that, in terms of, the kind of trainings or what they already had coming in. And I think you said about literature review, but, is our program performing, how many other states have this kind of training program, and are they also seeing similar or different outcomes? Would be helpful as we're trying to figure out what we do next with this program.
And we should allow, in addition to the JLARC staff, it sounds like there's some questions that ESD staff may want to introduce themselves and respond to.
Yeah, I'll take a crack, and then I think maybe ESD folks could chime in. So the question about union workers before and after the program, I think, as far as I know, there was no data certainly included in the net impact analysis. I am not familiar enough with ESD systems to know whether they collect that information when someone files for unemployment. Definitely, certainly get back to you if the ESD representatives can't answer that question. For the your second question was about education. The report did actually include educational history of participants and non-participants. I know ESD went to quite a bit of trouble to get longitudinal education data for all the people who participated, as well as all the people who didn't participate that were matched with. And so they did, one of the matching criteria was people's educational backgrounds. And since the pool of potential peers in the general unemployment population is so large, they were often able to find very, very similar people to compare them to who just didn't enroll in training benefits. So I don't know if that fully answers your question about educational history. For other programs, I'm not familiar exactly off the top of my head with the number of other states. It's not a lot of other states that have programs just like training benefits. I think if I recall from our 2016 report, it was about 6 back then. And a few of them have been studied in this way. And they also are not, what those evaluations tend to show is that the programs are pretty good at increasing the likelihood that someone will be employed. So their chances of getting a job compared to peers, non-participating peers, but their earnings, because of the foregone earnings, are lower over time. So it is a similar performance to other states. There was one program in New Orleans, so this is just one data point that we looked at, where the careers that people could train for were very narrowly tailored. I believe there were advanced manufacturing, certain healthcare occupations, and maybe in certain IT occupations. So a very narrow set of training programs, and that did find some positive earnings effects, but that actually was the only one that we found. All the others were negative.
Does our ESD staff want to introduce themselves and offer anything?
Good morning. My name is Stephen Ross. I'm the Chief Analytics Officer here at ESD. And I'm also going to invite Steve Ruggles to chime in as well. When it comes to the couple of questions that were addressed, Ryan did a pretty thorough job there. The only additional piece that I would like to talk about is union representation. We do have a lot of information around occupations and industry, but we don't necessarily post reemployment, collect whether or not those individuals are part of a union. And so because of that, there would be a little bit of subjectivity on whether or not we make assumptions based off of whether they're staying within industry or out of industry. But Steve, I also would invite you to speak about UI claimants pre and post reemployment.
Yeah, good morning. This is Steve Ruggles. I'm the UI products manager for ESD. When a claimant does file for unemployment and we put them in the program, we do collect whether they came from a union occupation, if they belong to a union. However, when they become reemployed, we do not capture that. So that would be the challenge there. As Stephen had indicated, there'd be some subjectivity in that data.
All right. Senator Wagner, you've been very patient. Your turn.
Well, thank you, Mr. Chair. And I think you set this up nicely with the Mythbusters reference, because it's an unexpected result. I'm wondering, I may have missed the slide, but was there a slide that showed the absolute numbers of people who have been in total helped, or maybe not helped, through these cohorts?
We didn't have a slide about it, but I can tell you that the number of people that participated in the program in the 19 years of data that ESD and we looked at was 35,000 people.
Oh, thank you.
I'd like to ask ESD or JLARC and ESD. Our state has what is widely been viewed as a model dashboard, allowing for people to compare the costs of attendance of both degree and certification workforce training programs at post-secondary institutions, comparing, for example, whether the medical assistant program at the community and technical college near them results in a higher level of placement, wages after certification is received, student debt, so terrific outcome-based data to compare programs. And I'm wondering if when ESD is approving someone and advising them to go into a retraining program, is ESD using that data and directing people, or perhaps not allowing people to enter a program where, for example, the outcomes in terms of wages after graduation, or it's, first off, successful completion are lower, and wages may be lower than the next program on the dashboard. And I know the Workforce and Training Board is investing in improving the dashboard even further. So are we using that?
I think that would probably be a question best addressed to ESD.
ESD?
Yeah, this is Steve Ruggles. Again, I'll take a stab at that, Nick. If you want to add anything, feel free. But yeah, when the applicants apply, they are strongly encouraged to use the services of the WorkSource staff or the partners in the workforce development councils. But the claimants can send their application in without that assistance, and we do find some lacking of quality applications when that happens. But yes, we do. When the adjudicators review the application, they do look at the occupation demand list, the earnings capability, and the labor market that they're in. As well, and even dive into, are they willing to relocate, and if so, where are they willing to relocate, and the demand in that area. So while there's probably room for improvement to get better data and statistics, they do look at that data to help guide and either allow or deny an applicant based upon that criteria.
So that is not my question. And I'm raising this because several years ago, we raised this question, legislators raised this, about the lack of connection between WorkSource and use of the investment by the state in the dashboard. So if I'm looking to be a medical assistant as my retraining, I can go online with this fabulous tool that's award-winning that we're investing more money in from the state to update, that shows that the 3 programs in my region, 2 may be at for-profit institutions and 1 at this community college. And the one at the community college has a 20% greater rate of completion and higher pay on average for those who complete. And I'm wondering if part of the problem is the lack of use of our tool in saying to people, you know, we're going to direct you to the program. You're choosing a high demand field. Here are the programs in your area, and we're going to direct you to the program that is actually going to result in the greatest likelihood of completion and highest wages after completion, using the state's dashboard and having a connection with the workforce board on this.
Yeah, Mr. Chair, I'm sorry, I didn't mean to interrupt. We don't have anybody from the Employment Connection side here, which is the ESD staff that works directly within the WorkSource system. So why don't we circle back with them and then provide you any information about the utilization of the dashboard in that process.
Great. Look forward to that. And I think we'll follow up with discussions with the workforce board and SBCTC on that. Okay. Any other questions? If not, I'm going to thank our JLARC staff and the ESD staff for coming in front of us. This poses some really unique policy challenges for the legislature to address, and it's a terrific report. And we will be sharing it out to the, after we finalize it, we'll take special effort to share it out with the committees of jurisdiction with materials to make sure that we try to encourage them to dive in to the problems that are being highlighted. With that, we will move to the next item on our agenda. Call this the 7th inning stretch. If you want to stand up for 30 seconds, stretch your arms out. And our next item on the agenda will be the HCA budget structure. And this is a proposed final report. So.
All right.
Okay. Give people 10
Everyone
seconds.
Stretched out.
Stretch. All right. Okay. All right. Ryan and Rebecca, please take away.
All right, so good morning again, Mr. Chair, members of the committee. I'm still Ryan McCord, and I'm here to present the final report on our review of the Healthcare Authority's budget structure. And in this report, the legislative auditor concluded that the complexity of the authority's accounting structure reflects service delivery and helps to fulfill reporting requirements. The expenditure forecast work group that includes HCA, OFM, and legislative staff lacks a formal structure that could improve the utility of and confidence in the forecast. And so as a reminder, we presented the preliminary report at this September JLARC meeting. And today I'm going to focus on the forecast process and the forecast work group, since that is what the legislative auditor recommendation is about. So the 2020 legislature directed JLARC to review HCA's budget and accounting structures. And we focused on Medicaid, which is the largest part of HCA's budget. Medicaid has been part of its budget since 2011. Medicaid, as I'm sure you know, provides health coverage for eligible adults and children, and that coverage includes both medical assistance and behavioral health services. And the program is funded with a combination of state and federal matched dollars. The Medicaid medical assistance budget is based on 2 major processes: managed care rate setting and expenditure forecasting. $14.5 billion of the 1921 medical assistance budget, which is about 75%, was related to managed care, and 16.7 billion, or about 85%, was subject to the expenditure forecast. Although HCA and legislative staff have some input, it's actually an independent actuarial firm that develops the rates that HCA pays to managed care organizations. The work group is composed of 15 members from OFM, HCA, and the legislature. The group meets twice weekly throughout much of the year to complete 2 forecasts, one to support the governor's budget and one to support the legislature's budgets. OFM forecasting staff lead the process. First, those staff pull expenditure data from the state accounting system and organize the data by service and caseload. So an example of a service caseload grouping would be inpatient care for the blind or disabled caseload. Then they calculate the historical amount spent per person for each service and determine the most accurate trend line for those expenditures. They adjust the forecasted trends for previously authorized changes to the program and benefits. And then once the work group agrees on a final draft, OFM budget analysts and legislative fiscal staff translate it into the regular legislative budget format. And that format, as you know, shows how next biennium's costs would increase or decrease from the current appropriation if there were no new healthcare policy proposals. The legislature's medical assistance appropriation generally reflects the amount from the forecast, and then of course adjusted up or down for any new policy proposals. The legislature transferred responsibility for the forecast from HCA to OFM in 2016. Workgroup members, we found, use the forecast process for different purposes. For example, legislative and OFM staff use it to monitor expenditures, and legislative staff use it to identify issues with HCA accounting and program management. But HCA staff use other processes to accomplish those purposes, they told us. The work group does not have a written charter or bylaws. The Washington State Institute of Public Policy reviewed the work group in 2003, and that report recommended formalizing the work group structure and processes in a written charter. The Caseload Forecast Council and Economic and Revenue Forecast Council are 2 other forecast entities that also have a large role in state budgeting, and those entities' structures are written down in statute. We reviewed academic literature, which suggests that a structured process can build confidence and acceptance in the forecast among the people who rely on it. So the legislative auditor makes one recommendation. OFM should lead the work group in developing a charter that specifies its purposes, structure, and decision-making protocols. Some of the elements of the charter should include protocols such as a level of agreement necessary to finalize a decision and how inquiries for additional analysis will be prioritized, rules for settling disagreements, how assumptions are documented and communicated, and how the forecast will be compared to actual expenditures to test its quality and accuracy. We recommend that OFM implement the recommendation by December 31st, 2022. And both OFM and HCA said they agree with the recommendation and will work to implement it. So that's all for my prepared remarks. And as you noted, Mr. Chair, we have members from HCA in attendance. I believe the CFO, Megan Atkinson, is here to make some comments and answer any of your questions. And of course, I can answer questions.
And I believe OFM has.
Exactly, sorry. And OFM has a representative too, I apologize.
So since we're slightly ahead, does Megan Atkinson, would you like to offer any comments?
Thank you, Mr. Chair, members of the committee. Yes, Megan Atkinson, CFO at the Healthcare Authority. I don't have any prepared comments. I would just thank your staff for the work on this audit. It was a very, it was a very good engagement. I think it went very well. As Ryan indicated, we have concurred with the recommendation, and I'm here to answer any questions you might have. Thank you.
And any thoughts from our OFM staff?
Hello, this is Eddie Rouser from OFM Forecast, and I agree. We concur with the findings of the report, and we're here to listen, and if comments are necessary, we can answer.
And in terms of working on a charter structure, is OFM, I assume you believe that the timeline suggested is appropriate?
Yes, that timeline is, and we'll work. If we're the lead on putting that together, that's fine. I think we were assuming that, but we want to make sure that's true.
Any questions from committee members? Not hearing any questions or seeing any hands raised. At this point in time, I would entertain a motion to approve for distribution the review of the Healthcare Authority's budget structure proposed final report. Do I have someone making a motion? Representative Orcutt?
So moved.
Do I have a second?
Second.
Senator Berg is seconded. Thank you. We have a motion in front of us to approve the final report. Are there any comments that anyone would like to make in support of the motion or in objection to the motion? I will just take the opportunity to thank the staff of JLARC and the HCA and OFM and all the participants who have collaborated in looking at the review and looking at the structure. This is a very complex area, and it's greatly appreciated to recognize that a formal structure would be helpful and commit to it. With that, we can do a voice vote, and I would like to ask for all in favor of adoption of the proposed final report, please say aye.
Aye. Aye.
Are there any opposed to adoption of the final report? Any opposed? Not hearing any opposed. Is anyone abstaining from voting on this report? In that case, would we please record that the vote in adoption was unanimous from the members present? Thank you. Our next item is also an action item, and it is the proposed final report on the impact fee deferral programs. So a local government topic. And let's see, who is presenting? Jennifer and Aaron, and we have David Pringle from the Department of Commerce available for questions. So, Jennifer?
Okay, great. Well, good morning, Chair Paulette, members of the committee. My name is Jennifer Sulcer, and I'm joined by my colleague, Aaron Cavan. And we're staff to the committee and here to present our proposed final report on impact fee deferral programs. As a reminder, we presented our preliminary report back in September. And the legislative auditor conclusion for this report is that impact fee deferrals have been infrequent and concentrated in 5 local governments with few adverse effects. And the financial benefit of deferrals could increase if market conditions change in the future. The legislative auditor makes 3 recommendations regarding impact fee deferrals, which we will discuss in the following slides. And as you may recall, impact fees are one-time charges developers pay on new construction to help pay for new or expanded public facilities. And builders typically pay these fees up front when they go and pick up their building permits. But in 2015, the legislature required local governments that collect impact fees to adopt a deferral program, which would then allow builders to delay the payment of these fees towards the end of the construction process. And there are several requirements laid out in statute on how to implement deferral programs, but the part we will focus on today does involve the impact fee deferral liens. So for our study, we first determined which local governments collect impact fees, because by law, they were the ones that were required to have a deferral program in place. And we were able to identify 107 local governments that collect impact fees, and 98 of those have a deferral program. 18 of those had a pre-existing deferral program, and the other 80 implemented one as a result of the 2015 law. And at the time of our study, we identified 9 local governments that had not yet implemented a deferral program. And this brings us to our first legislative auditor recommendation, and that is that the cities without a deferral program should pass an ordinance to adopt and maintain one as directed by statute. We did ask the agencies, including the 9 cities, for a formal response to the recommendations, which are part of our final report. But we do want to note that there were 3 cities who do not concur with this recommendation, citing that they don't believe the program yields much benefit. We also collected data on deferrals for 2018 and 19 and found that while 98 local governments have deferral programs, deferrals were requested and issued in just 22 of these, which are depicted on our map here. And these 22 local governments collectively issued 3,741 deferrals. And of those more than 3,700 deferrals, 91% of these were requested and issued by the 5 local governments illustrated in yellow. And we interviewed the staff at these 5 local governments and learned that their deferral programs have a few things in common, including they do not require a lien to be recorded in order to defer the impact fees. They do not charge administrative fees, and they do not require additional paperwork to be filled out or have additional steps as part of the deferral process.
Local governments report that more than 99% of the deferrals were repaid on time, and we found that only 3 of the deferrals issued in 2018 and 2019 were not paid on time or in full. To put that in perspective, we estimate during that time that local governments with deferral programs collected about $323 million in impact fees and issued deferrals on about 11 million of that. And of that 11 million, 13,000 was not paid on time or in full. Stakeholders reported that deferrals have not caused delays in capital improvement planning or construction, and local governments report that they have implemented controls to ensure that the tracking and collection of fees, including withholding final inspection until the fees are paid. Local governments must require builders to record a lien against the property unless they establish their programs prior to the state law. We spoke with stakeholders and heard some common concerns about the lien requirement. They reported that the lien deters builders from requesting a deferral, requires extra time and resources to process, track, and record, complicates and delays construction financing, creates a situation where the deferral lien may take priority over the mortgage lien, which is an obstacle to traditional construction financing, and may delay sale. This brings us to the second legislative auditor recommendation. The legislature should consider whether liens are a necessary tool to ensure that deferred fees are paid. The Department of Commerce and the Association of Washington Cities concur with this recommendation, and OFM and the Washington State Association of Counties have no comment. JLARC staff created a model to estimate the financial impact of the deferral, and the chart here illustrates the results from that model. So each circle represents a local government with a deferral program, And under current market conditions, deferring fees may provide some benefit in those circles to the right of the $0 line on the screen. And in circles to the left of the line, the costs of using the deferral outweigh the savings that would be gained from it. Now, if interest rates go up in the future, and if the length of the deferral period goes up, then the benefits of deferring would correspondingly increase. An interactive version of this model can be found in Appendix B of the report, where you can also see the fees and predicted benefits for each local government. Finally, we want to note a data collection requirement. The legislature directed the Department of Commerce to collect and report information about the number of deferrals requested, issued, and not paid on time or in full. However, ongoing monitoring by Commerce may be unnecessary. This brings us to the third legislative auditor recommendation. The legislature should either repeal Commerce's data collection or identify which measures Commerce should collect that would be helpful for evaluating program use. Commerce partially concurs with this recommendation, stating that they favor repealing the data collection requirement rather than modifying it, and they are available today to discuss their response. That concludes our presentation. Our contact information is on the slide, and we are happy to answer any questions, and representatives from the Department of Commerce are also available.
Thank you, Aaron. Senator Wagner.
Thank you, Mr. Chair. With respect to the liens, what other mechanisms could be used to ensure payment if the lien is taken away as a tool?
We spoke with local governments about this issue, and for the most part, what they reported was that they had other sorts of controls, such as they could withhold the final inspection of a property until those fees were paid, or they could withhold an issuance of a certificate of occupancy until those fees were paid. And for the local governments that do not have a lien requirement, they typically use those ways to ensure that those fees are eventually paid.
Thank you very much.
Mr. Pringle, do you want to introduce yourself and comment on behalf of Commerce?
Thank you, Chair Paulette. Good morning, everyone. I'm Dave Pringle, Policy Advisor with the Department of Commerce. And as Aaron and Jennifer indicated, we generally concur with the report and would recommend removing the data collection requirement, as the fee deferral program is functioning, has limited impact on the construction of single-family housing costs, and we see no risk in really discontinuing this data collection project, and we could better prioritize staff resources elsewhere. But thank you for your time, and happy to answer other questions if I can.
Thank you. Any other questions? At Chair's prerogative, I will let people know that we had the JLARC staff present the preliminary report to the House Local Government Committee at a work session recently, and Vice Chair Dewar is preparing legislation to implement these recommendations. So if you have an interest, please contact Representative Vice Chair Dewar. Senator Hasegawa, you have a question or comment?
Yeah, thanks, Mr. Chair. I'm just trying to get this whole issue sorted out. So I don't understand why the legislature, I guess we did, maybe a reference to which bill established this program that required a deferral to be established when there is an impact fee charge. Do you know what bill that was that set that up and what year that was? I mean, I'd like to look into it, because a deferral program, I presume it was to incentivize the building of more units, but that does have an impact on water, sewer, utilities, schools, roads in the area. So I don't understand how cities are supposed to make up that difference if they're required to create a deferral. So, well, that's one issue. And then the second issue is, I don't understand why we would not want to continue to collect data, because it seems like if nobody's watching, then where's the incentive to pay the impact fee? We need to know that it's being collected, or how many. I understand it was only 3 circumstances out of some large amount that were not paid. But it seems like data collection is still a worthy endeavor. Otherwise, we're just operating in the dark.
Senator Lovelet, are you commenting or following on to Senator Hasagawa, or are you a separate question? And should I?
I mean, I could, but I do have a separate question.
All right. So let's, if our JLARC staff could go through the limitations on the use of the deferral, and again, how your findings in regard to how jurisdictions are able to count on the money for the improvements, whether it's parks, roads, school districts.
Yeah, so to first answer Senator Hasagawa's question, it was engrossed Senate Bill 5923, and that was passed in 2015. And the legislation was at the request of the builders. They found that it was difficult to sort of recover from the last economic recession, and having to come up with sort of this money up front, the cash to pay these impact fees, was difficult. It was hard for them to get financing for those impact fees. And so they asked that the fees actually get paid at the end, closer to the end of the process, when they would have been able to secure at that time a construction loan. So it wasn't that they were going to evade or not pay the fees. They just wanted it to be pushed a little bit further while they could get the financing that they needed to get the project underway. And so there was a concern, of course, of the fees not being paid, which was the result of the impact fee deferral lien. It added sort of this level of protection that if the builder did go bankrupt or they did walk away, there would be this extra level that the city could then guarantee that the fees would be paid. But when we interviewed over 50 stakeholders, they said that, and a lot of the cities in the county said that they were having success with the fees being paid, that builders really wanted to have a good reputation within that community because they tend to stay in the same areas and build. And as Aaron had mentioned before, the cities and counties really felt or feel confident that they won't even schedule a final inspection until those fees are paid, which is very important to the builders and, of course, to a bank that has financed that construction project. And so that in and of itself adds sort of this certainty that the cities will get paid because they won't go out and do the inspection or issue the certificate of occupancy, which is very often needed by the bank in order to allow that house to go for sale.
Thank you for that. I would note, I just looked, and Senator Hasagawa, you should, feel assured you did vote no on the bill, reflecting your concerns.
Nice to know I'm consistent over the
yes,
years.
Yes, indeed. Isn't that good? So did I, but I would now say that I would recognize that I think I, was overly concerned about the impact because of the ability to withhold sort of occupancy. Senator Lovelet, would you like to ask your question?
Thank you, Mr. Chair. I think this might be for Commerce. I mean, among the data that has been collected, do we have a sense of how many units were then put onto the marketplace? For example, I know Ferndale has had enormous growth over the last couple of years, and just wondering if we have any kind of correlative information around having this deferral program actually resulting in X amount of units. Thank you.
Thank you, Senator Lovelet. The data collection that we do doesn't provide those unit construction alongside the deferral collection information. So we'd have to do a cross-check with other existing construction data to take a look at that. So I'll check with our team to see if that's something we can put together or where something like that might be and get back with you.
All right, I'm going to close us out on discussion here. And again, we have Senator Short. Yes.
Yeah, thank you, Mr. Chair. Just a follow-up to the discussion. I think if he is able to provide that information, I think it's a good question and would ask that it be provided to committee members.
Sure.
Happy to do that, Senator.
Okay. With that, I'd like to ask for a motion to approve for distribution the report. Vice Chair Orcutt.
Move to approve.
Second. Senator Loveland, second. Thank you very much. Is there any discussion on the topic prior to voting on the distribution of the report? Any discussion? All right, in that case, the motion, Senator Hasegawa, please.
Yeah, just a quick clarification. So the question is whether to pass the report on to the full legislature.
That's right.
Not necessarily that we agree with what's contained in the report.
That is correct. Our votes are to approve the report for distribution, and we may offer comments. We have a process for considering comments from members as part of that vote if someone has submitted that in advance.
And if I may, Mr. Chair, we to Senator Hasegawa's question, we include a statement in the report that also explains what the vote means as well, and that it does not indicate it's taking a position necessarily on recommendations.
Thank you.
With that, all in favor of the motion to approve for distribution the impact fee deferral program proposed final report, please say aye. Paulette Cook.
Aye.
All opposed, please say nay. Are there any abstentions? Please report that the vote for approval of distribution was unanimous. Thank you. Now we will go into the annual review of tax preferences conducted by the legislative auditor and staff, and as well reviewed by the Citizens Commission on tax preference performances. So let's take that away. And I think the most efficient way of going through this would be to pause briefly after each one, very briefly, for any question. All right.
Good morning, Mr. Chair, members of the committee. Eric Thomas, staff to JLARC. I'm presenting the proposed final report of JLARC's 2021 tax preference performance reviews, in which the legislative auditor recommended action on 4 of the 7 preferences that JLARC staff reviewed. We can also report this morning that the Citizen Commission unanimously endorsed the recommendations and additionally adopted comments on 4. The focus of this morning's presentation will be on the Citizen Commission's comments on the legislative auditor's recommendations. You'll recall that in July, JLARC staff presented the preliminary reports to JLARC. In August, we presented the same preliminary reports to the Citizen Commission, which then took public testimony from interested parties and stakeholders in September, and reconvened in October to adopt comments on the legislative auditor's recommendations. So over the next few slides, I'll briefly review the legislative auditor's recommendations on the 7 reviews that JLARC staff completed this year, and then highlight the 4 reviews that the commission commented on. Following my comments, the chair of the Citizen Commission, Dr. Grant Forsyth, will discuss the commission's role, its members, and the comments that it adopted. As I mentioned, the legislative auditor recommended action on 4 preferences. Recommended allowing 1 preference to expire. Recommended that the legislature clarify the intent of another. And as you recall, the legislature took action on one of the recommendations in the 2021 session for targeted urban area exemption. As I mentioned, I wanted to a bit more of a focus on the legislative auditor recommendations that the commission commented on. First was the credit for renewable energy program payments. The legislative auditor found that the program mostly met the metrics and statute, but did not broaden low-income participation. Recommended that the legislature allowed the program to expire as the installations had continued after the funding limit was reached. Second was a preference for the health benefit exchange, in which the legislative auditor recommended that the legislature extend the July 2023 expiration date or make the preference permanent, as it appears to address a structural tax issue by allowing the exchange to maximize their appropriations and not pay the B&O tax. Third was reduced B&O rate for printing and publishing newspapers. The legislative auditor recommended that the legislature review the preference to determine if it provides sufficient relief, as the preference has been in place for 12 years and the newspaper industries continue to lose revenue and jobs. So review whether additional assistance is needed to help these businesses stabilize financially. And finally was a suite of medical cannabis tax preferences. The legislative auditor recommended that the legislature continue these preferences and that the Departments of Revenue and Health update taxpayer guidance to reflect 2019 legislative changes. Both agencies concurred with the recommendation, and there's representatives from each agency here to answer any questions that you may have. That concludes my prepared remarks. I'd be happy to answer any questions. We also have lead staff for each of the reviews also available.
Well, I'd like to open up by asking the chair of the Citizens Commission to introduce yourself and allow us to thank you for the work you've done and offer any additional comments, Dr. Forsyth.
Thank you, Representative Paulette. My name is Grant Forsyth. I'm the chair of the Citizens Commission. My day job is the chief economist of Vista Corp, which is a utility based in Spokane. The first thing I just want to point out is really all my fellow commissioners are highly qualified professionals. I mean, if you look at the list that you see there, we've got a great depth and scope of experience. These are tremendous people to work with, actually, because of that experience, and they bring a lot to this process. That would also include, by the way, our non-voting members, which of course is Representative Paulette and State Auditor Pat McCarthy. When we do review these, our goal is really to try to speak with one voice. It's extremely rare for us to have a dissenting opinion among the commissioners. And I think this again reflects the willingness of the commissioners to talk things out, compromise, and come up with, really pretty good opinions of the JLARC work and maybe even raise some issues that JLARC hadn't considered to bring that to the legislature. So with that, next slide. So I just want to briefly talk about some of the comments that were made on the preferences, in particular 4. And let's go ahead and start with the credit for renewable energy program payments. One of the things I think is important to point out about this is that there's some interest in extending this to low-income households. However, one of the problems with solar is that you actually either need to have the money up front to put solar on your residence, okay, or you need to be the owner of the residence. And so really for low-income people, there's a lack of income or a lack of ownership. And so to increase participation of low-income households, I think the legislature is really going to have to review this and try to come up with solutions to those 2 issues. Medical cannabis, okay? There was actually a fair amount of testimony on this from one particular individual. And really, all we suggest here is to really look at what other states are doing to better understand the difference between recreational marijuana and medical marijuana. And I think that's the main issue. It's a fairly complicated issue, as you know, we had discussions with staff about this, in part because there's not a lot of research that can be done on the benefits of medical marijuana because of the inconsistency between the states and the federal government on this issue to this point. But it may be worth the legislature's time to go back and review this issue and to see whether or not finer distinctions can be made between, you know, the medical uses and the medical treatment of medical marijuana and just the recreational marijuana. The health benefit exchange, I think there was really pretty strong consensus that this should actually be excluded from future reviews. As tax preferences go, it's really not a tax preference in the purest sense. It's really part of a broader policy initiative relative to healthcare. And we do strongly recommend it just simply be removed from future reviews. Now, the tax preference that actually probably got the most interest was the reduced B&O rate for printing and publishing newspapers. And so the basic comment here, you know, consider alternative approaches. The current preference might be too small, and local papers still support democratic and community vitality with news absent from national digital providers. Offer alternative format for residents with barriers to accessing digital formats. In other words, local papers provide some benefits that maybe the national digital formats don't offer. It's just going to be worth your time to review this. We got a lot of written testimony, especially from smaller newspapers, suggesting that this preference is still important to them, but may still not be large enough. So with that, I will open it to questions.
Do we have any questions for Dr. Forsyth? Senator Hasagawa.
Thank you, Mr. Chair. I appreciate the Commission's analysis on the renewable energy program payments and the health benefit exchange. My question has to do with the last one that you talked about on the reduced B&O rate for printing and publishing newspapers. So did the Commission consider that there should be any conditions placed on in return to receive the reduced B&O rate, such as, because when papers have such a significant market share that they can influence political opinion, that there should be some fairness doctrine or something associated with that so that there's not undue political influence being portrayed, or the reduced B&O rate, which actually is it's a funding mechanism of the public to support the continuation of that paper. And if that paper is using its market share to influence the public unduly, and not just carrying local news or whatnot, that essentially is the public financing public opinion. And that, so I was just wondering if the Commission had considered any strings attached to that B&O rate.
We did not. In fact, that didn't come up at all, as I recall, in any of our discussions. I think the main point of the discussion was that we focused on was, you know, what is the size of the benefit? Does it make a bigger difference between large papers versus small papers? The testimony we got suggested that it's still relatively important to small papers compared to bigger papers, but we never discussed the issue of, you know, how would we make this preference conditional?
Thank you.
Any other questions? Senator Wilson.
Thank you, Mr. Chair. I'm not sure that would be a question of Well, I think it's a constitutional question. The First Amendment allows for the freedom of the press. So I'm not sure that we would be able to put conditions on that, although I do agree that they can have undue influence. So, but that's, I guess, the freedom of the press. So,
Well, Mr. Chair, if I can
please
follow up. Yeah, I agree with the freedom of the press, but this is a use of taxpayer dollars really to fund some of that political messaging. For instance, I recall years ago in a gubernatorial race that a major metropolitan newspaper took out a full page ad in support of a political candidate. And to me, if they can afford to do that, they can afford to pay the taxes. Otherwise, we're just subsidizing that kind of political influence.
So I think there is a totally separate issue of the role of media, the role of digital media and influence than in front of us. We have a tax exemption. The tax exemption was, and the history is laid out in the report very well, that it was initially intended in order to help for the purposes of helping the role of democracy, which journalism is fundamental to, that the B&O rate would be 0.29, adopted in 2009. And that was raised to rate increased revenue 2 years later to 0.36. Rather than being reduced back to 0.29, it was reduced to 0.35. And that will expire in 2024, if I'm correct. Is that the correct date for expiration from the staff?
Yes.
Okay. So that is, the context. And if it expires, it goes back to 0.4. 0.48, is it, Eric? Somewhere in there.
Yes, sorry about that.
Okay. Senator Mullet and I have proposed an additional comment, taking into account the Citizens Commission comment on the Legislative Auditor's report. And this was submitted and circulated to you all in advance of the meeting. And if we could put that up, and it's the only comment that has been submitted. It goes through the history from the report, and has what I think is really shocking findings from the report, that the revenues of local newspapers have declined precipitously. Employment in journalism has plummeted, local journalism, because of that decline in revenue. And the legislature had intended for the rate to be 0.29% and never returned it to 0.29%. So the operative language here is the legislature should consider what rate from 0 to 0.29% is warranted in light of the precipitous decline in local journalism, employment and revenues, what performance measures should be included in the extension with the new rate. And I think that's a very important statement, that you want performance, we'd be adding that there should be performance measures, as there always should be with tax preferences. And then the final sentence, the committee also recommends that the legislature consider additional means of supporting local journalism, such as grant programs, as other states have done. Senator Mullet, would you like to speak to it or offer any changes?
Well, I think first off, I think Representative Orcutt, I thought had a good suggestion during the executive committee discussions that the last sentence we could remove, in the sense I think he had some legitimate concerns that if we're doing grant programs, it could be a way of being viewed as maybe rewarding newspapers that are more favorable to the legislature, et cetera. And so I would like the committee to maybe just consider the first 4 paragraphs. And I guess for me personally, my anecdotal experience is I got elected in 2012. My paper in Issaquah is closed. My paper in Maple Valley is closed. My paper in Snoqualmie no longer does print. I don't have a print paper left. I had 3 when I got elected in 2012. And so I thought that, you know, Grant Forsyth and the Citizens Commission was on the right path of saying we should probably be open-minded to maybe what do we have to do in the space. But I will also say that I have tried to keep all committee, I would like everything to be bipartisan. And so I just think we're kind of having open democracy right now. We're kind of curious to see if there is any bipartisan support for this idea. And if there is, then I think we should adopt it. And if there isn't, then I'm not going to be offended if we wait. I don't know. So that's my 2 cents on it.
So that's an invitation for comments. Rep. Frame, and then Rep. Orcutt. Thank you.
Rep. Orcutt's hand go up first, Rep. Paulette, so I'm happy.
I'm sorry. Rep. Orcutt.
Thank you, Mr. Chair. Thank you, Representative Frame. I wouldn't have been opposed if you had gone first. It would have been fine. I'm opposed to this. I really think that as JLARC, we should not be instructing the legislature on any particular outcome or how to use a report. I think we should be focusing on did the auditor meet the objectives of the report? Are there any limitations to the report? Are there any things that could be misread with the report and provide clarification along those lines? That's what I think we should be limited to, rather than recommending how the legislature should use the report. Therefore, I'm going to be opposed and voting against adoption of the proposed committee amendment.
Rep. Frame.
Thank you, Mr. Chair. I guess I'm just having a couple of feelings just about this whole thing. And I just feel like I need to say on record that, you know, the idea that asking for tax revenue is contributing in a significant way to the decline of local journalism. I just, on its face, I think it's, you know, there's a lot happening in the world of journalism. And I think whether or not we are collecting taxes has a very, just, it is not the main contributor to the decline of local journalism. I'll just say that. I think there's a lot of other external factors. I'm having a hard time just listening to this presentation in general. And second, you know, whether it's a grant program or a tax expenditure, which is defined as sort of choosing to forego revenue, it's all state dollars. So I personally am in favor of including the last line. I'm a little agnostic overall, but I just want to say tax dollars are tax dollars, whether it's going out in form of grant or it's going out in foregoing revenue. So do with that what you want, Mr. Chair. Thanks.
I don't know what to do with that. Senator Wagner.
Thank you, Mr. Chair. I'm thinking that the first 3 lines, as I read them, are just statements of fact. And I'm a little sensitive to the last 2 because, as Representative Orcutt pointed out, maybe that steps out a little bit outside of the role of JLARC. Perhaps if those last 2 recommendations were, and that's the part it's the recommendation part that we're kind of prodding the legislature to do something that sort of runs awry, at least of my personal philosophy. So absent removing those two lines, I would be reticent to vote for this.
The last sentence has been removed by, it's no longer in front of us. So the only recommendation in front of us would be after the first three statements, recitations would be what rate the legislature should consider and what performance measures should be included. I do think that both are consistent with the report and clarify the report, especially on the performance measures that should be included. But is there anyone who is interested in joining in supporting this? Because otherwise, I think Senator Mullet, correct me if I'm wrong, we would, based on your interest in this, we would not move it for a vote if we don't have.
Yeah, I think that's a fair. Thank you, Chair Paulette. If it's not bipartisan, I think my whole goal on the executive committee of JLARC has always been if there's bipartisan additions, I think we should make them. If it's controversial, then I think JLARC is better to stay out of the recommendations from this committee. So I'm fine to withdraw it at this point. I'm not hearing any bipartisan support, and so I'm fine to withdraw this recommendation.
Okay. All right. Senator Hasagawa, do you still have a comment or question?
Yes, thanks, Mr. Chair. So I'm sorry, I lost they pulled that proposed document off of the screen, but on the performance measures, I'm very interested in what you were thinking about those performance standards. On the last sentence that Representative Frame actually supported, I think there's the problem. There's a lot of good community-based newspapers out there who really struggle. You know, there's like a South Seattle Emerald or Northwest Asian Weekly or whatever it is. Unfortunately, in order to survive, they've had to become 501c3s, which prevents them from having that kind of political position on certain on political stuff. So what we're doing is probably lowering the tax rate on for-profit institutions, bringing them down to a rate closer to what the nonprofits obviously don't pay, but they're struggling, and their voices that actually represent the community's interests are muzzled, but the for-profits are not muzzled. So that's, to me, the bigger problem is how do we, why should taxpayers have to subsidize the political positions of the larger media outlets? So that's what I struggle with, and lowering the tax rate is not conducive to uplifting those community-based voices who have to file as C3s instead in order to survive and continue to at least present news out there.
I would point out that, that is the grant programs in other states are designed around exactly the concept that you have there, that they support local journalism through nonprofits often, rather than grants directly to. So they support in-depth investigative and local journalism through nonprofits is the typical model from other states. That's not in front of us anymore, that part of it. Rep. Orcutt and then Senator Wilson.
Thank you, Mr. Chair. As I understand it, we do not actually have a motion in front of us. So
That's right.
therefore, I would like to make a motion to approve for distribution the 2021 tax preference reviews proposed final report as presented to us. And just to clarify, that would be without the proposed committee amendment addendum.
We have a motion and a second. Senator Wilson, you had your hand up, but do you wish to
Good.
speak on the motion?
No, thank you.
Are there other comments on the motion to adopt the report of the legislative auditor on and forward to the legislature along with the Citizens Commission comments? Any further comments? In that case, let's vote on the motion, which is to approve the report of the legislative auditor and forward with the Citizens Commission comments. All in favor, please say aye. Aye.
Aye.
Aye.
Aye.
Are there any, any nay votes? Please say nay. Anyone opposed, please say no, nay. Not hearing any nays. Is there anyone abstaining? In that case, the record will reflect that the Joint Legislative Audit Review Committee has voted unanimously to forward to the legislature the report on tax preferences and exemption reviews for 2021 to the legislature with the Citizens Commission comments. And I think we all owe an incredible debt of gratitude for the in-depth work and the thorough discussion by the Citizens Commission members. It's just incredible to watch them in action and see them dive into the questions and hear the evidence and ask the questions. And it's really, there's no reward other than good public policy. And so thank you very much to the chair and the members of the commission. And to our JLARC staff, I think I want to offer a round of huge applause for the incredible work that you do on the tax preference reviews. It is just, this is probably the best model in the nation for doing reviews like this, and you do the most incredible, very credible, evidence-based review of these tax preferences. So please join me in applauding. Is there any good of the order? Representative Orcutt.
Mr. Chair, I just have a question for Keenan. Do we have an I-900 meeting this afternoon, or is there not one this afternoon until then the next one would be in January? Is that correct?
Correct. Yeah, we don't have one for today. We will be having one in the afternoon on the January 4th date when we have the regular meeting in the morning. That was the only other thing I wanted to remind folks of. Our January 4th meeting will be after the holidays, of course, and you'll be hearing about our annual report on public records responses. We get a briefing on our work to incorporate racial equity analysis into future studies. And then, of course, we're going to hear the proposed finals on the two preliminaries we heard this morning on the training benefits program and the school employees benefits board.
And could you just remind us, or actually let's just send out a reminder to people by email of how we've adjusted the schedule to try to take into account avoiding trying to meet during session. And just look for that in your email. The executive committee has tried to make adjustments, and we welcome everyone's comments on how the proposed schedule would work, okay? With that, the meeting is concluded, and I wish you all a wonderful December and holiday season, and see you all on January 4th. Thank you.
Good, thank you.